We're now going to focus on just a brief introduction to some of the equipment that you might need when you inseminate cows and the actual technique. So this is pictures just looking at some of the equipment, and we can see a typical AI gun, a straw, and an external sheath that would fit over the AI gun to provide a sterile environment for the semen. Usually we have some obstetrical lubricant, gloves, some sort of thawing flask, and this can all be put into a container, and you can use that to transport your equipment around. The actual technique, initially we'll wipe the cow's vulva with a paper towel to make sure it's clean. We'll place our arm into the rectum, and we will then insert the gun into the vagina, and making sure to elevate it a little bit dorsally so that we don't pass it into the opening of the urethra. We then grasp the cervix with our hand, and then we position the insemination gun into the external os of the cervix, and then with the hand that's clasping the cervix, we then manipulate the cervix and assist the insemination gun to pass through the cervical rings that form a bit of a barrier to the AI gun. Once the gun passes through the internal os of the cervix, we generally stop and then deposit all of the semen into the uterine body. The uterine body in most cows is quite short, only sort of in the order of 2 to 3 centimetres, sometimes less in younger animals. And so we don't want to pass that gun too far along past the internal os of the cervix, otherwise the gun will inevitably pass up one horn, and if that happens to be the horn on which that is contralateral to the preovulatory follicle, then pregnancy rates can decrease. So generally we put the semen into the uterine body, and the aim there is for that semen to be equally distributed through both the right and the left uterine horns. So this is just an illustration of that. The cervix has been grasped, the insemination gun is being passed through the cervical rings. Here's the external os of the cervix, here's the internal os. Once the gun passes through the internal os of the cervix, with your finger you can usually feel when the tip of the gun is past the internal os of the cervix, and at that point you simply deposit the semen. This is an illustration of what you're aiming to do, that is to deposit the semen such that you get an equal distribution of semen between both uterine horns. And this is just an example here of some cervical rings. And here we're putting the gun through, and we're just through the internal os of the cervix, and this is where you want to deposit the semen. Note here how short that uterine body is before the uterine horns branch into the left and the right horn. If you continue to push this gun through, you'll inevitably either go up this horn or this horn, and that can result in a decrease in pregnancy rates. Again, this is what happens if you push the rod in too far. It goes up one horn and all the semen gets deposited here. That's okay if the preovulatory follicle is here, but it's not okay if the preovulatory follicle is on the other side, and you'll get a decrease in pregnancy rates. This is just showing an illustration using some radio-opaque material. Again, showing you just going through the internal os of the cervix, depositing the semen, you're getting an equal distribution of sedum. If you push that gun too far, you'll deposit that semen into one horn rather than getting an equal distribution of semen. So again, for this section here, you should review the technique that's used for the rectovaginal technique for insemination of semen in cattle. You should know where that semen should be deposited, and then you should be able to answer these questions. When we look at this question, the correct site for the deposition of semen into the reproductive tract of cows using artificial insemination in order to obtain optimal pregnancy rates is the vagina. No, you'll get a decrease in pregnancy rates if you deposit semen into the vagina using the doses of semen that are normally cryopreserved. The cervix, no, you'll get a reduction in pregnancy rates here. Depositing half in the cervix and half in the uterine body, again, no. The aim is to deposit that semen into the uterine body and not into a uterine horn, into the uterine body, so D is the answer here. What's the impact on fertility of inserting the insemination gun too far through the internal os of the cervix when inseminating cows in terms of pregnancy rates? Explain your reasoning. Well, if you push that rod too far through, pregnancy rates may decrease. And this is because in some of those cows the semen will be deposited contralateral to the ovulating oocyte, and so the opportunity for fertilisation will be less, and so you get a reduction in pregnancy rates. So when we're aiming to inseminate cows, we should be inseminating them in through to the body of the uterus only.